lot of questions about this. Now, calcium is crucial for optimal bone health throughout your life, but do you know if you're getting enough and how to increase if you aren't? Dr. Bev Huang is a naturopathic doctor with Grassroots Naturopathic Medicine. She's here with all the details. And I know this is like something you know inside and out, but I think the average person, especially as a woman,
right,
you're told at a certain age you're supposed to start taking calcium, but then there was some study that came out saying don't.
Yeah.
So first of all, let's start with what calcium actually does in your body.
So calcium is important because our body doesn't make it. So we need to get it from food sources, possibly a supplement as well too. It's important for our bone health, it's important for our nerves to send messages, for our muscles to contract, so it's really an essential mineral that our body needs.
Okay, and like everything, does it start to deplete over time? Is this what happens?
It is, like there's a hormonal component to it, especially in women, so this is why women are talking about it more so. Okay. But in terms of our diet, we need to look at different variety of sources of calcium coming into our diet as well.
Okay, and how much, if we were to talk sort of measurements, how much optimally do we
most adults need between 1,000 and 1,200 milligrams per day. We generally look to our dairy sources in terms of calcium, but there's also some really great non-dairy sources of calcium, especially for those people that don't tolerate dairy very well.
Okay.
So you got to think about things like almonds or almond butter, broccoli, kale, white beans. Sesame or tahini as well too are great sources of calcium that are not a dairy source.
Okay.
And so usually when I talk with patients, I talk about also kind of fortifying their snacks or meals with different things. So they might be adding yogurt into their smoothie, but you might also want to add, you can blend in some kale if you have a pretty decent blender, or using some almond milk, or looking at your salads and stir fries and maybe putting, sprinkling some sesame seeds or like the sliced almonds on top of your stir fry as well too, or almond butter on a piece of apple as a snack.
Is there some way to kind of know if you're getting enough, like some way to personally measure, or just work on incorporating these things?
You can do all the math and figure out how much you're eating. I mean, we'll talk a little bit about kind of sources if you are going to go to a supplement.
Right.
Women usually after the age of 50, 55 are often offered a bone density test with their doctor to assess where it is. The challenge with that is when you're looking at all the work beforehand, you're kind of 30 years late. So so it's better late than never, right?
Right, but you
in
should
terms
be
of the
working
calcium,
on
but you
it.
should be working on it as we go through our adulthood. So.
Okay, so at what point would you personally recommend that somebody take a calcium supplement?
Well, if they've taken dairy out of their diet, that's a big thing. So whether it be for reasons that they have a food sensitivity, or they might be a vegetarian or vegan, they don't take in dairy sources, usually I'm looking at a calcium supplement. If bone health and osteoporosis is a health concern of yours, there's a form of calcium called MCHC, so microcrystalline hydroxyapatite calcium. It's a mouthful. Okay. But really, like a study in the Journal of Reproductive Medicine has shown that this form of MCHC has been better at maintaining bone density versus a common form of calcium carbonate. Okay. So not all supplements are even created equal amongst that, but it really depends on where your health concerns are at. I also talk about vitamin D as well too, because if calcium is a lock, then vitamin D is the key for it, right? So our bodies require vitamin D in order for the calcium to be absorbed. So especially here in Calgary, I mean, well, today's a really great example in terms of not getting enough sun exposure, but we're not getting enough sun exposure, especially during the winter months, to stimulate our own vitamin D. So I usually recommend 2,000 to 4,000 IUs per day. Some doctors might go higher, some might recommend lower. Really getting your levels tested will give you the best idea in terms of what's most appropriate for you.
Okay, and finally, what are we looking at over here?
Well, this one I also talk about acid-base balance. So sometimes it's not just about that 1,000 milligrams per day. Sometimes it's talking about what else is happening in the body and how are we using that calcium to begin with. So with something like this is a mineralizing formula that's in an alkaline form. So when our body's more acidic, it uses calcium to neutralize those acids. So then the calcium essentially doesn't even make it into the bone. So a mineralizing formula such as this, or even like a greens powder that you can add into that smoothie as well too in the morning, is a great way to make our body more alkalinized. Then we're able to actually absorb and store our calcium where it needs to be.
Okay, if you have more questions or you feel like you need a personal assessment, Dr. Bev is a great person to see. Where do we find you?
I'm at Grassroots Naturopathic Medicine here in Calgary.
Full disclosure, I visit very often. More information and links, breakfasttelevision.ca. Thank you for braving the weather to get here.
Great, thanks, Sarah. It's good to be back.
Braving the weather this morning at the Glenmore Reservoir. Craig Larkin's in for Jill Bell and getting ready for the Calgary Dragon Boat Race and Festival.